affected his hearing and his brain function. So this is what we usually do with him. He doesn't really have any pain today because he's under my care. So Dr. Katie, wherever you are right on with it. We can help with pain. So the first thing that I do is I look at his pelvis. How I do that is by looking at his feet. So I bring him together here, and I don't know if anybody can see this, but his left leg is shorter than his right. So what does that mean to me? What that means is this part of his pelvis has rocked down and back, which will rock up the leg. So when that happens, we will start correcting here in just 1 second. I'm going to assess the rest of the spine because this is just the way I do it. So I'm going to assess the rest of the spine and come back down and start on the pelvis. So again, what I'm doing is I'm just feeling up the spine, and that was tender there because he jumped a little bit. As I feel up the spine, what I'm looking for are the joints to kind of feel like they're like stuck. They're supposed to feel spongy and move under my hands nicely, but there's a couple that are feeling stuck. So there's one right here in his lumbar spine, also known as the low back. One right here in his thoracic spine, which is the mid-back. And then also C1, which is at the base of his skull. And that's where a lot of his headaches come from. When that C1 rotates, it cuts off the function up to the brain and doesn't allow everything to get up there nicely. And he can tell you about that later. So again, I'm coming back down to make sure that I didn't clear anything out weirdly, and this is still happening. So I'm going to go ahead and start with adjusting his pelvis. So by doing that, I'm going to have you turn to face me this way. So he's going to lie on his side. Basically, I just tell patients to lay there. I will do the work for you. Don't have to worry about what position you have to be in. I will make sure you are in the correct position. So, a lot of men get scared on this part because I really roll far to get up over to adjust. So, I have never dropped anybody yet. It's been 10 years. Nobody's gone to the floor. So, I will contact his low back with my right hand.
You should practice a few more years. He'll drop them.
Dr. Cody, don't jinx me. So what I'm going to do is I'm going to put my leg on top of his, bring him towards me, all the way out, and thrust down, and you hear the movement of the spine. We're going to go the other side now. Now, when you hear that cracking noise that everybody refers to, it's really not the bones breaking, because I had someone say, are you breaking my bones? No. What it is just air in between the joints being released. Now, remember that tender spot I said he had in his low back lumbar spine? That's what we're going for on this side now. And then again, nice deep breath in, and he's going to come with me, and I won't drop him. on his stomach. So now I'm going to go back and I double check to make sure that his low back did clear out and he's even. So this is now in position the way it's supposed to. So now I'm going to go up to the rest of the spine here. Check that one again. He's not jumping anymore. And then we're going to talk about doing this area. And again, it's a nice deep breath in, all the way out, coming down with them. Very simple, very easy. It's not a huge forceful thing. Most people think this is a big scary thing, forceful, that you're going to hurt them. No. On your back.
Nicole.
A minute. Now I'm going to take care of that C1 that causes his wonderful headaches. And this is not a ninja move. I'm not totally rotating and taking them out. This is very precise, and we just bend a little bit and rotate. Bend a little bit and rotate, and that's all it is. Now, some people don't like the manual adjustment. They're scared of their neck being done. Go back on your stomach. Scared of their neck being done, or they just don't like the cracking noises because it freaks them out. So I use this instrument. It is called an activator. This is great for people, one, who are scared, for the elderly who are osteoporotic, and also for children. So basically, if I was going to adjust him, I would assess the exact same way, but then I would just start using this on him and poking away at him. Now, it turns all the way up. I don't know how many people can see that. See these rings right here? It turns all the way up, and that is a pelvis setting. Or it turns all the way down, and that is more of a neck. See how my hand's not moving now? But with the pelvis, it does. So that is what I do in my office. So a lot of people don't know what chiropractors do. They've never seen it done, so I thought I'd demonstrate it here today. Any questions?
No, but she does a really good job.
Cassandra's seen it over and over again. So.